Sometimes we'll also begin with injections as well of certain anti-inflammatory medications. I wanted to talk briefly today about a condition that we see very commonly in our dermatology practice at Dermatology Specialists of Illinois, and that is a condition called alopecia areata. This condition presents often with small patches of hair loss, and they can be single or multiple, and like I said, they're patches. They're small circular areas usually where the hair may present relatively suddenly with loss. And the scalp can look smooth in those areas, and they may slowly or rapidly expand. Sometimes there's just one lesion. Sometimes it can present with dozens of lesions simultaneously. And obviously, once it becomes noticed by the patient or their families, it becomes quite distressing. And so they often present for treatment. They're concerned that this may lead to permanent hair loss, and they're really concerned about what could be done about it. So let's talk a little bit about this condition and then what can be done about it. Alopecia areata is caused by an autoimmune skin reaction. The patient's own immune system starts attacking the hair follicles. We don't understand what turns this on, although stress may play some role in this triggering this condition. When the immune system attacks the hair follicles, they tend to fall out very quickly. And there are variants of this disease that can spread to affect the entire scalp and also the eyebrows, eyelashes, and body hair as well. The treatments of this condition are very different than other forms of alopecia treatments. We usually want to calm down this overactive immune system, and we can do that in many different ways. Often, on the initial approach, we'll use topical anti-inflammatory medications that we will prescribe for the patient. Sometimes we'll also begin with injections as well of certain anti-inflammatory medications. These often can resolve cases where the amount of hair loss is minimal, and it can be in a very effective way of treating them. Sometimes it requires more than one injection, so we follow the patient monthly until they improve. For more advanced cases, or cases where the entire scalp is affected, we may have to use systemic anti-inflammatory medications, and there are several of these. In recent years, we've had huge developments from the pharmaceutical industry. They have manufactured new classes of drugs which work very effectively with minimal side effects and can promote hair regrowth. And if we continue on those medicines, we can sustain excellent growth as well. Alopecia areata is very disturbing to patients, and they want a quick fix. Often it's not a super quick fix, but we definitely can make great progress with our patients who have this disease. We are asked sometimes if hair transplantation would be an appropriate strategy for this condition. And sadly, it is not. It is very important to see a dermatologist first if you present with such a patchy hair loss, because we need to have someone who's a hair expert evaluate and determine what the best treatment course is for you. We are aware of non-dermatologic hair transplant surgeons who offer hair transplantations to cover this alopecia areata, but because the origin is autoimmune, we have to deal with the immune system and medications to address that, rather than transplanting hair from other areas that could subsequently also be attacked by the immune system. So it's really important to see someone who really understands skin and hair diseases first. So that's usually going to be a board-certified dermatologist prior to looking at hair transplantation as an option. Hair transplantation isn't the best option for this particular condition. At DSI, we're happy to see you and evaluate you. We may order blood work as well. Sometimes a biopsy may also be performed in the initial analysis of this condition. So we'll get you on the right treatment path and get you under good control. We have many options to get your alopecia areata treated. If you like this video, hit the like button and subscribe. Follow us for more hair-related content.